Chapter 8, Video 2. In this video, we're going to talk specifically about wandering atrial pacemaker and multifocal atrial tachycardia. Wandering atrial pacemaker and multifocal atrial tachycardia are also known as WAP, W-A-P, or MAT, M-A-T. With wandering atrial pacemaker, this is an example of an atrial rhythm. The key difference with wandering atrial pacemaker and multifocal atrial tachycardia is the heart rate. These two rhythms are the exact same rhythms. The heart rate is the distinguishing factor of whether you're dealing with WAP, wandering atrial pacemaker, or multifocal atrial tachycardia. A sinus arrhythmia differs from wandering atrial pacemaker because they have uniform P waves, okay? So in a sinus arrhythmia, remember, sinus tells us that it's firing from the SA node. So if we're having that sinus arrhythmia, the P waves are going to look the same. They're going to be uniform because the rhythm is originating in the SA node. But with wandering atrial pacemaker and multifocal atrial tachycardia, the key word here is atrial. We know that this rhythm is occurring in the atriums, and it has usurped and it's took over that sinus rhythm. So with wandering atrial pacemaker and multifocal tachycardia, we are going to have at least three different shaped P waves. And why are we going to have those three different shaped P waves? Because we've got three or more irritated area. Each foci produces its own unique P wave, and it has a rhythm that you're going to see this on the rhythm strip because we're going to have those three different shaped P waves. And so with wandering atrial pacemaker, we have three different shaped P waves. The difference between wandering atrial pacemaker and multifocal atrial tachycardia is MAT, multifocal atrial tachycardia, has a faster heart rate. So we have criteria here that we're gonna look at and we're gonna go through. And guys, you have to know this criteria to be able to apply it. Remember, you need to know the difference in a sinus arrhythmia versus wandering atrial pacemaker and multifocal atrial tachycardia. That sinus arrhythmia is produced in the sinus node, so you're going to see those uniform P waves. But with wandering atrial pacemaker or multifocal atrial tachycardia, they're produced in the atrium, and there's multi areas of that atrium that are irritated that's going to produce those P waves that look different, okay? So you're going to see those different P waves. With wandering atrial pacemaker, the mean heart rate, again, we have to know how to figure out and work through these rhythms, okay? So the mean heart rate is less than 100. Usually a mean rate in the 50s to 60s with wandering atrial pacemaker. With multifocal atrial tachycardia, the mean rate is greater than 100. We have an irregular rhythm, and we have at minimum, three different shapes in P waves. Some beats may have no visible P waves. The PR interval here varies. The QRS is less than 0.12 seconds. And causes of wandering atrial pacemaker include medications, hypoxia, which is a low oxygen level, vagal stimulation, or an MI, which is a myocardial infarction. With multifocal atrial tachycardia, COPD and heart disease can cause this, and COPD stands for chronic obstructive pulmonary disease, okay? One thing that you'll see a lot of with these COPD patients, you'll see that multifocal atrial tachycardia or that MAT. That's seen often in guys that have COPD or that chronic obstructive pulmonary disease. There's usually no ill effects associated with wandering atrial pacemaker, but with multifocal atrial tachycardia or MAT, we often see those signs of decreased cardiac output if that heart rate is too fast. The treatment for WAP is usually no treatment. There's usually no ill effects. But with multifocal atrial tachycardia, they often give beta blockers or calcium channel blockers if they see those signs of decreased cardiac output. And those beta blockers and calcium channel blockers, they slow that heart rate. So when we look at this strip, and you're given this strip, and you have to figure out, okay, is this rhythm? What is this rhythm? I've already started with sinus rhythm. Now I'm adding to it. I'm working with the atriums now. So how am I going to determine if this is an atrial rhythm or if this is a sinus rhythm? Where do I begin? Where do you begin to work the strip out? You begin with the 5 steps of rhythm interpretation. So what is the first question? The first question that we ask ourselves is, are there QRS complexes? The answer here is we do have QRS complexes, and they are shaped the same. Now we ask ourselves, is the rhythm regular, irregular, regular but interrupted? What is this rhythm? So we can take our piece of paper, and remember we have to count between the R and R's, but as you can take a piece of paper and lay up against the screen and put a dot here and a dot here, and you can kind of drag it across and measure between each one. That's a quick way of doing that, but there is a variation. There is a variation of more than 1 to 2 little blocks between this R and these R's. So if you count from R to R, there's a variation here. So with that variation, we're able to tell you that this rhythm is irregular. Now we need to figure out what is our heart rate. So we know that we have an irregular rhythm, so we're going to have to use that 6-second strip method, where we find our mean rate and then we find our range. So we have a range of 50 to 60, and we have a mean rate here of 50. Okay? So what is our heart rate here? So we figured that out. Now we need to ask ourselves, are there P waves? Yes, the answer here is yes. We do have P waves. But look, let's take a look at those P waves. This one looks different than this one. This one looks different than this one. They all look different. So that tells us right there, okay, these P waves look different. So we know that that doesn't fit into the criteria of being a sinus rhythm. We know we have an irritated area in the atrium that we have to figure out now what it is. So we do have P waves. They are shaped different. And the next question is, are they married to the QRS complexes? Do they precede the QRS complexes? And the answer is yes, they do. There is a P wave for every QRS complex. And then we ask, is the PP interval, is it consecutive? Is it regular? The PP interval here varies because we have a multifocal area here. They're shaped different, so they do vary. Now, we need to ask ourselves, what are the PR intervals and what are the QRS intervals? The PR intervals here, and we'll go back to our slide if you don't remember how to calculate it. Go back to the slide where we went over each PR interval. And that segment where you know where the PR interval's at, then you count that out and count your little blocks and multiply that by 0.04, and that will give you your interval here. We have a variation on this particular strip. It's 0.24 to 0.32. Our QRS interval is 0.08. It is normal, okay? So it's narrow, and that's what we expect to see. So we know that because this QRS interval falls within normal range, that we don't have a ventricular rhythm we're dealing with, but because we have different P waves, and our P waves here look distorted, we are dealing with an atrial rhythm, and we know it's not a sinus rhythm because our P waves look different. So this fits the criteria of wandering atrial pacemaker. So moving forward, we're given this strip. If you're given this strip and you have to choose from all the different heart rhythms, we're going to ask ourselves the same questions. Are there QRS complexes? Is the rhythm regular or irregular? What is the heart rate? Are there P waves? How are they shaped? What are the PR intervals and the QRS intervals? So we have a QRS complex here. It is uniform in shape. We've determined that this rhythm is irregular. Since it's irregular, we need to find the range. So we're going to use the 6-second strip method. And we have a heart rate range of 107 to 187 with a mean rate here of 120. We do have P waves that vary in shape. The PP interval varies. The PR interval varies. The QRS interval here is 0.06, which is normal. So we know, because we have those P waves that vary in shape here, that they don't look the same, that's not a sinus rhythm. So this fits the criteria of multifocal atrial tachycardia. So I hope this helps you guys in understanding. You're going to ask yourself those same questions as we go through every rhythm moving forward. So please make sure that you understand those questions and you apply those questions to every single strip. If you have any questions, please let me know.